Welcome, Srini Reddy, Dr. Srini Reddy, to the Dating Intentionally podcast. How are you?
I'm great. Thanks for having me.
Yeah, I'm so excited to have this conversation. When I asked my audience about egg freezing, my DMs exploded. I had no idea that so many people were interested in learning about this process. I'm really interested in learning about this process. And I want to just jump right in and ask you, how did you get here in this career path?
Great question. So when I was in med school, I did a rotation in infertility and loved it. And then when I did my residency in OBGYN, so I was trained as a gynecologist before this, I was actually deciding between complex family planning and reproductive endocrinology and infertility as my two possible fellowships. Complex family planning is like contraception and abortion access, whereas REI, reproductive endocrinology and infertility, is like IVF treatments and endocrine disorders and things like that. So one side is terminating or preventing pregnancies, and the other side is creating pregnancies. And so I think a lot of people were always a little bit confused, like, how could you be torn deciding between these two things? And for me, it was just like, well, I kind of feel like a woman should be able to decide whatever she wants to do, however she wants to do it.
Mm-hmm.
So for me, autonomy, I think, was always kind of reproductive autonomy was always forefront in
Got
advocating
it.
that for my patients. And then medically and science wise, just infertility is just the coolest thing there is. It's just the most cutting edge stuff. So I wanted to be where the action was. And I really love being there for my patients.
That's awesome. And how long have you been with Spring Fertility?
I'm new actually. I just started with Spring last year. I was finishing up my training in Texas and then moved back to California. This is where my family's at.
Yeah, very different weather.
Yes,
It's very different.
absolutely.
But yeah, that's awesome. And then, okay, so what is your exact role? Like, when would I see you in the process?
Yeah, you'll see me the first time you come to a Spring location. So patients will call or go through the website to set up a consult. And then when you come for your first appointment, that appointment will be at a Spring location, and your appointment will be with a physician. So you'll meet me that first day. The appointment starts with us just kind of getting to know each other, getting to know kind of your medical history, your gynecologic history, what your family planning goals are, what your
Mm-hmm.
goals for the visit are. We just kind of gather all that type of information, put that together, and come up with a game plan from there.
Got it. Got it. So again, like I said, I got so many questions about this. And, I asked my mom about this because, she's in her late 50s and she said that egg freezing wasn't talked about, like she had me in the 90s. So it's like egg freezing was a thing in the 90s, but like no one discussed it. It didn't really come up as an option. I'm an IUI baby. Like,
Oh, wow.
so yeah, she like definitely was in this world in terms of like going to the doctors and like talking about all this stuff, but egg freezing just like didn't really seem like an option.
Actually, interestingly, so we've been doing, IVF to get people pregnant for decades, but actually egg freezing for social reasons, social fertility preservation reasons, was only deemed non-experimental in 2012. So
Oh
we've
wow.
been freezing eggs for a longer period of time than that, but specifically we used to do it for like cancer patients who were getting chemoradiation and we were worried about the function of their ovaries afterwards. That was primarily the population that we were doing it in prior to 2012. Since
Right.
2012, it was then deemed by the FDA to be non-experimental, and that's kind of really when egg freezing started exploding, which is why you've heard about it so much more in the last decade than before
Yeah.
that. Yeah,
I know at
exactly.
least 5 people personally who have already gone through the process, and like
Wow.
several more of my friends are considering it. So, and that's just people I know in my life. Obviously, people in my who are listening, there are lots of people I think who have gone through the process or like are in it now or thinking
Yeah.
about it. So, let's get into it. Like, what are some of you mentioned patients who had cancer and they're like freezing their eggs for that reason, but what are some other reasons people would come in and want to start this process?
Yeah, so there's a lot of different reasons. A lot of people are having their kids later, or maybe they're not sure they even want to have children. They're focused on their career, they haven't found the right partner yet. For a myriad of reasons, people may choose to either delay childbearing or they're undecided about childbearing. And so they'll come to kind of just see what their options are. And egg freezing is great because, you'll never have better quality eggs than you will today. And so it kind of preserves your better quality eggs from a younger age should you want to use them later.
Got it. It's yeah, I mean, it makes sense. It's like, okay, they're it sounds bad, but it's like you're not getting any younger, your eggs aren't getting any fresher or help or like viable, I guess, with time. So it makes sense. Like, and we'll get into that more. But can you just walk us through the process and how it works? Like, I know there's kind of like the setup, just the preparation, there's the actual retrieval process, and then what happens afterwards. So let's start with the initial like where to start. Like I'm coming to you, I'm like, "Okay, Doctor Reddy, I want to do this. Like what do I do?"
Yeah, yeah. So first, it starts with an initial consultation with a physician where they kind of review your history, your background, and you kind of align on what your goals are. That initial appointment will also include a transvaginal ultrasound, which is the best way to take a look at the ovaries. So it gives us an idea of kind of what your anatomy is, and also gives us an idea of what your egg count is, your antral follicle count. And so, what that is that women are born with all the eggs they'll ever have. At puberty, that's like 500,000 eggs. By the time you get to menopause, you basically run out of eggs. So, somewhere when patients are coming to see me, they're somewhere in between that. So, they still have hundreds of thousands of eggs. And every month, if you have regular cycles, one of those eggs grows and becomes a mature egg that then ovulates. If you have sex at the right time, egg and sperm can meet and you could get pregnant technically. But what happens is every month when you have your period and the body realizes it's not pregnant, the ovaries kind of wake up a batch of eggs. They wake up a group of eggs and in hopes of getting one egg to grow and ovulate. And whatever spare eggs were recruited that month that didn't quite grow and ovulate will die off. And that's kind of how we channel through 500,000 eggs in our lifetime because we're not ovulating 500,000 times.
Yeah, I was like that sounds like so much.
Yeah,
Okay.
so that's so many eggs to burn through, right? So the
Yeah.
way we burn through them is that we recruit a group of eggs at a time, and only one of those will ovulate and the rest will die off. So we're actually constantly using up and losing eggs throughout our lives, which is so sad.
Wow. I was reading a little bit about that, like I was just kind of diving deep down the rabbit hole of this as in preparation. And I kept reading like it's a numbers game, it's a numbers game. And it truly is a numbers game, even in our own bodies, it sounds like. Like even if you're
Yeah,
not doing this process,
that's
like
right.
our
That's
bodies
right.
know it's a numbers game.
That's right. That's right. I mean, human
Damn.
reproduction is so inefficient. And so the body's just like constantly stacking the deck by like trying to recruit multiple eggs to just get one to grow.
Right.
And so when we do that initial ultrasound, we can get an idea of what your antral follicle count is, what your monthly egg count is. How many eggs does your body wake up at a time?
Mhm.
Is it 5? Is it 10? Is it 15? Whatever number it is. How many does your body wake up at a time to try to get that one egg to ovulate? That number is going to vary from person to person. That number is
Mhm.
going to vary from age to age. And so that for initial ultrasound is really important because it gives us an idea of what your baseline is, where you're living. It also lets us set some expectations that if we were to do egg freezing, how many eggs we would get.
Mm.
Because when we're talking about egg freezing, we are talking about giving you hormone medication in injection form. It's the same hormone that your body already uses, your brain uses to talk to your ovaries to get that one egg to grow every month. It's called FSH. We'll give this hormone to you in injection form, what your body is already used to, just in a little bit higher
Mm.
doses, to try to get as many eggs as possible to grow rather than just the one. But what is
Got
as
it.
many as possible? As many as
Mhm.
possible is going to depend on you and your body. How many eggs your body has to give me is how many I can grow for you.
Got it.
So that
That is so
initial ultrasound,
interesting. Oh my gosh. Okay.
yeah. So that initial ultrasound tells me, where do you live? Is it
Yeah.
10 eggs every month? Okay, well, if you wake up 10 eggs every month, then if I give you injection medication, though I'm trying to target those 10 eggs to grow. And so
Mhm.
it helps you and me set some expectations from the beginning of should we go through this
Right.
process, what realistic goals are.
That is really okay, this is again, what if it's such a random question, but, like, let's just say I don't really I'm not gonna freeze my eggs, but, like, I'm just curious about this one number. Is it still like, do I still go to a Spring Fertility Center for that kind of just, like how many eggs do I have every month now? It's not a thing.
Yeah, absolutely.
No.
No,
Oh,
no,
you
no, no.
can? Okay.
Yes, absolutely. For sure.
Sorry,
We get
you were shaking
patients.
your head, so I said no, but okay, you're confirming this.
Who knows what my head was doing, but absolutely. We get patients come in all the time, one asking just like, where's my fertility at? Like,
Right.
what should I even be thinking? We get patients who come in who are just like, I heard about egg freezing. I know nothing about it. I'd rather just
Mhm.
talk to a doctor than go down a deep Google like rabbit hole. And for any number of reasons, you don't have to even be thinking about actually doing egg freezing. Just come see us and we'll just kind of, we can do a little primer. We can just kind of teach you about it
Right.
and give you an idea of where this is. And so, yeah, absolutely. We can do that for you.
Got it. So, okay, so we've had our initial consultation. You can tell how many eggs I have each month. Then I'm like, okay, cool. Let's do this retrieval process. What's happening next?
Yeah. So we did the consultation, we did the ultrasound, we've kind of set some expectations with each other. Now to move forward, we're going to do blood work. Blood work
Mhm.
is going to be just kind of initial panel. One, it's going to look at infectious disease testing, but then it's also going to look at some hormone levels, give us a baseline. We talked about how the antral follicle count, AFC, on ultrasound gives us an idea of what your monthly egg count is. Another number that people look at to kind of understand what their ovarian reserve is a lab value called AMH,
Okay.
anti-Mullerian hormone. That's one of the hormones we test for. That gives you an idea of what that overall pool of eggs you have left is. You know, we said you had started with 500,000 at puberty. Now you've got some hundreds of thousands of eggs left. How many eggs you have left is going to be reflected in your AMH level. So that's another
Got it.
lab that you can get to tell you what is your ovarian reserve. So these are some of the initial blood work we'll also get at. We can draw it the same day as your appointment to just make it a
Mm.
one-stop shop. So
Nice.
once we have blood work, ultrasound, initial information, then we can get started with kind of the next step is going to be logistics, is going to be figuring out a calendar, a time to move forward.
Right. So yeah, because what's the window you need for this process? I read it was like a few weeks.
Yeah, yeah, yeah. Sometimes people are like, it's not months. And it's like, no, 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 it's just a couple weeks. So what the actual process itself is, you're going to take hormone injections, that FSH hormone,
Mhm.
for somewhere like roughly 8 to 12 days. So just under 2 weeks typically. Sometimes it can go a little bit longer. You'll do injections. You give them to yourself. We have videos to teach you, nurses to teach you. We'll talk you through it.
Mm.
They're pretty tiny needles. They're like little insulin needles if you know anybody with diabetes. So they're pretty well tolerated. You give the injections to yourself, or people can have like a friend, a neighbor, a partner give them to them as well. You give those injections to yourself daily, roughly 8 to 12 days. In that same like 2 week span that you're doing these medications, you're coming in for an appointment about 5 times in 2 weeks. So it is kind of a lot
Okay.
of
So you need to like
appointments.
be around. This isn't like, okay,
That's
I'm gonna
right.
start injection and like take a trip to Miami and then come back. No.
That's right. That's right. And that's kind of why the next stage is really just like the patient working with our care team to try to get a calendar together that fits your busy schedule. Because we do need you in town for this portion because we check
Right.
in on you so often. So, you know, and especially the way we all live now, trying to find 2 weeks that you're like
It
in town
sounds
with nothing, it's
simple, but I know
hard.
it's not.
Yeah.
Question. Okay, so one question that came up about this is there like a best time of the calendar year to do this?
No, no,
No.
there's
Do you guys have
not.
like a busy season to avoid?
There's not necessarily a busy season. We do technically close for about 2 weeks over the Christmas holidays to do
Okay. Yeah, I mean, I
quality
feel like
control.
that would be so hard anyway to do. I feel like that's like the worst time to schedule this. It's like
Yeah.
no one's around for those 2 weeks fully. And rarely are you around or have time, even if you are around, to like go to the
Yeah.
doctor. Yeah.
So we typically close then because, you know, like the lab usually like shuts all the machines down, does quality control, that type of
Yeah.
stuff. But
Right.
other than that, year round, we're good. We're open also 7 days a week. So every week. And so Saturdays,
Hmm.
Sundays, it doesn't matter. We'll see you. We'll treat you no matter what day of the week it is. So that's
So
not a concern.
what are some of the side effects people have from the hormones? It's like that's can be really scary.
Yeah, so we were talking about how it's 2 weeks of injection medications,
Hmm.
roughly about five appointments over the 2 week span. The reason for those appointments is that at the beginning, your eggs are all teeny tiny. Your follicles, which is the fluid filled sac that each egg is inside, those are all really small. As time goes on, they're going to grow bigger and bigger. And eggs are always microscopic through this whole process, so we can never see them on ultrasound. But each egg is inside a fluid filled sac called a follicle. And the size of that follicle correlates with the maturity of the egg inside. So at the beginning of this process, the follicles are all teeny tiny because the egg is immature.
Hmm.
As
Hmm.
time goes on, the follicles are going to grow bigger and bigger. And the size of the follicle, when it's bigger, is going to correlate with the maturity of the egg inside. So
Got
we
it.
need to do all these appointments to check in to see how those follicles are growing, how your hormones are growing. When as many eggs as possible are in the mature range, follicles are in the mature range, that's when we plan for your egg retrieval. So as those, because your ovary is used to growing one egg every month when you ovulate, and
Mhm.
now we're telling it to grow a whole bunch, right? Five,
Oh, yeah,
eight,
it's a
10.
lot.
It's a lot. So your ovary has grown in size and you're going to feel bloated and full. Those are your main symptoms.
Okay. I mean, like, look, if this is it's like when you think about the side effects, like, and how important this move is for so many people who are just want to, again, have some kind of insurance or some kind of just
Right.
backup plan, I think it's worth it.
Yeah, absolutely, absolutely. That first week that you're doing injections, you're probably not going to feel a whole lot because your ovaries are still pretty small.
Yeah,
But that second week of injections is when you're going to start to feel bloated and full because your ovaries are much bigger than they are normally. And they're just
right.
taking up more space. You're going to start to feel, you might start to have some fatigue because they're working so
Yeah.
hard. Once you're done with all the injections, you've got as many follicles in the mature range as possible. Now we plan for your egg retrieval. Egg retrieval is how we harvest those eggs. When we're with the egg retrieval, you can expect to feel cramping pain.
Mhm.
It's
Mhm.
not like you're doubled over in pain, you can't get out of bed. It's not like terrible pain like that. It's more like a bad period. And we will give you pain medications to go home with, but those are kind of the main ones. That cramping is going to get worse over the first couple days after the retrieval, and then it starts to get better. And by 7
Yeah.
to 14 days out, you're back to normal.
Okay, so it's like a 2-week process, but it's like a month of the of side effects that's like to
Yeah.
expect.
Yeah,
Yeah.
maybe 3 to
That makes
4 weeks.
sense.
Yeah.
Right. Right.
And then before you even get to the injection phase, which is those 2 weeks, sometimes there's a few weeks of like preparation where we prime your
Mhm.
ovaries. Maybe you need to take like a birth control pill or a progesterone only pill for a short period of time, something like that. So there might be some kind of low key stuff that's happening before the intense part. But the intense part is that 2 weeks.
So, okay, question. Yeah, this is the question I had. Like, if you're on birth control, like, how does that screw with this process at all? Do you have to stop? Like, what's going
Yeah,
on there?
it depends on the type of contraception. So if you're on birth control pills, we
Mhm.
will have you stop those for this process. And we may actually have you stop those for a month or two before going into this process because sometimes birth control pills can kind of suppress your ovaries, they can quiet them. And it's hard for them to wake up and respond to our medications if they've been on birth control pills for a long time. So sometimes we'll say, hey, why don't you stop them for a couple months and then let's take another look.
Mhm. Mhm.
Um, but if your contraception is something like the IUD, that can stay in place through this whole
Yeah.
process, doesn't
Right.
need to come out, and it doesn't affect outcomes. So it just totally depends what your contraception you're using
That's
is.
good to know. I mean, yeah. Okay, noted. Okay, so you do give some things to prime your ovaries for this process. Another question that came up is like, is there anything the patient can do to prime their bodies and their eggs, like just for this process to get the best result?
Yeah, that's a good question. So, the thing is these eggs have been in you your whole life, right? So kind of they've already been exposed to your lifestyle and how you live and all these things for years. And so I don't know that there's anything really to that we can.
You can do in the short term.
But yeah, there's not some magic solution. Things that we do know definitively affect egg quality is going to be like smoking, morbid obesity. So these are modifiable things that can totally affect outcomes. But beyond that, the way I tell it to my patients is happiest you is the best thing you can do, right? So like whatever is going to make you feel the best going through this process and help maintain your mental health and keep the most zen state of mind, that's the best. So if that's going to be like regularly exercise and eating well, great. If that's going to be wine night with your friends, great. Like whatever it is to like keep your peace of mind, that's going to be what's going to help the most, I think,
Okay,
anecdotally.
that's I mean, like, yeah, I mean, that's pretty solid advice, I think, just generally. And that's good to know. It kind of takes the pressure off. Like, there isn't anything that you can do to do you really have to do to affect this process other than what you are telling your patient to do, like with the yeah, okay, that makes sense. Okay, so we've done the injections. It's time for retrieval. What does that day look like? Retrieval day.
Yeah. So retrieval happens in our clinic, and if you're coming to Spring in the East Bay, which is where I work, it would be in the Oakland Clinic. We have a surgery center in our building. An anesthesiologist, a doctor comes in and gives you anesthesia through the IV, so you're
Mhm.
completely asleep for the process, but you're breathing on your own. It's kind of like very similar if you had like a relative or somebody get like a colonoscopy. It's like a similar level of anesthesia to that. You're not sleeping, you're not awake, but you're breathing on your own. The procedure is actually very quick. It's like it takes maybe 20 minutes all in. And so it's very quick. We do the procedure vaginally. So the vaginal ultrasound is the best way to see the ovaries. That's why all your appointments will include a vaginal ultrasound. So the same thing on the day of your egg retrieval, we're going to use a vaginal ultrasound and we put a needle through the side of the ultrasound. The way I typically describe it to patients is, when you get your blood drawn, they poke a needle through your skin into a vein and draw the blood out. I do this similar thing here. We're going to put a needle through the skin of the vagina, go into the ovary, and draw the follicle fluid out.
Got it.
So that's why your IUD can stay in place because we're not touching your cervix, uterus, fallopian
Mm.
tubes. We're just
Mhm.
going from the vagina into the ovary, and that's it. And same thing when you get your blood drawn, they poke you with a needle, they get the blood, they put a band-aid, and before you even get to your car, you're stopped bleeding. Same thing
Right.
here. It's a needle puncture site in the vagina. It's not like a big incision. There's no stitches, there's no cuts on your
I was
belly.
envisioning like an incision. I don't know why.
Yeah, yeah.
Yeah.
So it's actually just a needle puncture. And same thing as when they draw your blood. You hold a little pressure, it stops bleeding, and then that's it. And
Got
you
it.
find out the same day how many eggs we were able to freeze for you.
So yeah, what is I mean, obviously it's a range. Like let's talk about the number because I know this it's a numbers game like we were saying earlier, and I know that you can do this multiple times, right? How many times do you think is generally ideal if you're trying to go for like 30 eggs or something?
Yeah, so, that's actually where that initial ultrasound is helpful because how many eggs we can get in a single round of treatment is going to vary from person to person
Right.
because I can't increase your egg count. It just kind of depends where you live. So if you're somebody that has an antral follicle count of like 12 eggs, then the most eggs, I never expect I can get 100% of the eggs that are there, but I
Mhm.
hope that I can get the majority. And so maybe if you start with 12, maybe I'll get like 6 to 10 eggs in a single cycle. And those are
Mhm.
expectations we're going to set from the beginning.
Right.
And what I encourage our patients to do is that if you go to our website, springfertility.com, there's something on there called the egg calculator. What that is it shows you with how many eggs you have frozen at whatever age you froze them at, because all outcomes tie to the age that the eggs were frozen at, not the age you are when you come back to use them. So say you have 10 eggs frozen at age 36. You can put those parameters into our calculator and then you can see what is your chance of a live birth from these eggs.
Mhm.
It will give you a percentage probability. You can look at that and see how does that make you feel? Is
Right.
that
But
enough
like okay, hold
security?
on. So you're saying it matters more about the age you are when your eggs are retrieved, not the age you are using them. But like if
Yes.
you are 42
Yeah.
and you're using eggs you achieved at 32, it's like, but won't your body still have risk of having a pregnancy at 42,
Yeah. Great
even
question.
if you did
So,
that
yeah.
naturally?
So, say you're 42 using 32-year-old eggs. What's going to happen is you're going to thaw those eggs, put them with
Hmm.
sperm. We're going to thaw those eggs in the lab, put them with sperm, create embryos, let them grow for 5, 6 days into embryos, and we'll biopsy them to check the genetics to make sure it's a chromosomally normal, viable embryo. If it's a viable, genetically normal embryo, your chance of pregnancy with that embryo is the same regardless of age. So whether you're
Mm.
42 using a genetically normal embryo or 22 using a genetically normal
Oh, I
embryo,
see what you're saying.
your chance of pregnancy is the same. Of course, a
Right.
pregnancy at 42 is going to be a little higher risk than someone younger. And that's going to be like an increased risk of diabetes, high blood pressure, those types of
Mm,
things.
hmm.
But your chance of getting pregnant is the same regardless of age.
Got it. Okay, that makes sense with yeah, you're testing the embryos. That makes sense. I mean, yeah, it's such a long process. Like when it gets the actual retrieval and it's like the going in, doing the injections, getting the retrieval, it's short, right? As like a month. But it seems like it's a much longer. This is the long game with egg
Yeah,
freezing, right?
that's right.
Like,
That's right.
and it's so fascinating to me. So, okay, so you have the procedure, which sounds pretty. not that bad.
Yeah.
And as far as procedures can go, and still it could be scary for anyone who has not had anesthesia before, or
Yeah.
like just has bad experience with hospitals and just doctors in general.
Yeah.
Like that's all valid. You said there is pain after. What else can we expect like following the procedure?
Yeah, so that bloating that you've been having isn't going to go away right away. It's actually going to
Hmm.
get a little bit worse before it gets better. This new symptom is going to be some cramping. So all those symptoms are going to be kind of suck for maybe 2, 3 days after the retrieval, and then they'll start to get better. Usually by 7 to 14 days, you're totally back to normal. And the same day as your egg retrieval, the embryologist is in the room with us. And so when we drain those follicles, they look at the fluid under the microscope that live, like as we're doing the procedure.
Hmm.
So you find out how many eggs we get before you even go home that day. You're only with us for 2, 3 hours. Before you
Right.
leave, you know how many eggs we have. And so you can have an idea of like how everything went. But yeah, you need that day of the egg retrieval off of work because of the anesthesia. You'll be groggy, but you can probably go to work the next day. Sometimes people take the next day off of work if they have an intense job, but I did this and I worked the next. I was in surgery the next day and it was totally fine. So
Yeah, everyone's different. I mean,
yeah,
everyone listening, like your body best. If I was doing this, I would probably schedule this on a Thursday or Friday and take the next day and like have the weekend to recover.
and a
Even
lot of
though,
people do that. Yeah.
yeah, that's like that would be my move. So, okay. So let's just say we do this process, everything's great. We get like, a bunch of eggs, and I'm coming back 5 years later. I'm like,
Mhm.
okay, ready to use them. Let's go. Let's talk about storage. So you're storing these at the facility. Like, where are my eggs hanging out after they're outside of my body at this point?
Correct. So they're frozen and they're stored
Okay,
in liquid nitrogen tanks. And they're stored at the Spring Clinic. Yeah. So
got
they're
it.
stored at the same clinic that you had your egg retrieval in. They're stored in liquid nitrogen and they're safe. Once eggs are frozen, that's a stable state. So there's no advantage to using your eggs within 1 year or 6 years or 10 years. And so they're safely waiting for you whenever, if you need them or when you need them.
What's the cost of storage? Like, that's a monthly cost we forget exists,
Yes,
or
exactly, exactly.
yearly.
So there's
Yeah,
yeah, so there's upfront fee for like egg freezing medications, all that, and then there's an annual storage fee that I think is like 800-ish dollars. I don't know
for
the
a year.
exact number. Yeah, for a year,
And
something
look,
like that.
obviously, like it's gonna range where you go and all that stuff. So, I mean, that makes sense. Yeah, like, you gotta keep those eggs safe. Okay, then thawing and all that. So you're just like gonna take it out and be like, okay, we're gonna make these embryos, and then do you do the whole thing like I don't even know the term implanting? Like I
Yeah,
don't know.
yeah, yeah. Well, exactly. So it starts with should you come back to use them, we would
Mhm.
thaw the eggs, inseminate them with whatever your chosen sperm is, and let them grow into embryos, which is like a
Right.
5, 6 day process. Any that make it to that point, we biopsy to confirm that they're chromosomally normal. What percentage will be chromosomally normal is going to depend on the age of the egg that when it was frozen. And any chromosomally normal embryo is a candidate to go back in to help you get pregnant. We'll transfer one at a time to help you get pregnant. Roughly the chance of a live birth from each chromosomally normal embryo is about 60%.
Yeah.
And any spare embryos we have stay frozen until you need them.
Wow. Okay. Thank you for going into so much detail into each thing. Like it really helps. Just like, okay, this process is not that scary.
Yeah,
It's not. I mean, it is a big deal in the big picture of your life.
yeah.
Like it's a big decision, but at the same time, it's not. It doesn't sound too bad.
Good. I'm glad.
Yeah. And the biggest question that came up from my listeners and that I have as well is timing. It's like, what is the youngest we would be wanting to consider freezing eggs?
Yeah, so we can freeze eggs kind of at any adult age up until age 43. That's kind of our cutoff. And so you'll
Mm.
freeze eggs kind of at any point before then.
But
Um,
what's like, I mean, like in your early 20s, is that where that starts, or like
you know,
younger? Like
yeah, yeah, yeah. Let's just do it on toddlers. No, so if you think about it, your egg quality is largely stable through your 20s and early 30s.
Oh, interesting. Okay.
There starts to be a stable decline that starts around 35 and a much more rapid decline in egg quality at like 41, 42. But until 34, your egg quality is largely stable. And so if you think about it that way, I don't know that I think that like all 22-year-olds need to freeze their eggs, you know? I think it kind of individualize it depending on the person. But I think your quality is going to be the same before 34. So I don't know how much advantage there is to doing it sooner. Now, if you're somebody who happens to have a lower ovarian reserve, so maybe we're going to get less eggs, maybe that's a conversation to have that like potentially it makes sense to start the process earlier. There's kind of a bunch of different things that we can individualize. And that's where a consultation with the doctor, even if you think, hey, I'm only 29, I don't know that I'm going to do this right now, it might be helpful to talk to somebody, get that information so you can make a plan for going forward.
Right. I feel like another thing that would contribute to timing is like if your job covers it or not.
That's right.
I
It's
feel
huge.
like if you're at a job and you're not sure, but your job covers it, it's like maybe that's something to consider because
A
it's
lot of people do that.
expensive.
Yep.
Yeah.
No, that's a really common thing that people come in. They're like, hey, I have this insurance benefit. I think there might be layoffs soon, and I want to use up the benefit before I can. Very valid reason.
Yeah.
Absolutely. Because
Right.
it's not an insignificant cost. And so if your insurance covers it, that's also a great reason to move forward.
And yeah, without insurance, what kind of costs are we looking at?
So it's going to vary from clinic to clinic. All costs are always going to vary from city to city and clinic to clinic. At
Mhm.
Spring, egg freezing is like roughly $10,000, I believe. That's the cost to Spring for all your appointments, your egg retrieval, the anesthesia, the embryology. What it doesn't include is the cost of medications because that cost goes to the pharmacies, and that's
Right.
probably about $3,000 to $5,000 extra on top of. So
Got it.
yeah,
I mean, yeah, it's like we'll say 15 to 20 if we're being conservative.
yeah. Yeah. I think it's actually going to be more like 13 to 15 if you think about it, because it's
Okay,
10
got
plus
it.
3 to 5.
Yeah. And
But
that's without insurance.
that's without insurance, that's out
Yeah.
of pocket. But I will say we have a payment plan available for patients for egg freezing at Spring. And so it's like a no interest, no down payment type payment plan. And so you can just pay a monthly installment spread out over 40-ish months, which can make it really palatable. I think it becomes like a $250 payment every month, which is like a car payment or something. And so if you can
Right.
budget for it, maybe that makes it a little bit more in reach for patients. Still a lot.
It does seem to be a lot more accessible, even though it's really expensive, like really, really expensive. It does seem to be more accessible and hopefully getting more and more
That's
accessible
right.
as time goes on. Hopefully,
Yeah,
hopefully.
that's right. That's right.
um, yeah, we'll see. So, what are some of the risks that we have to consider when going through this process, if any?
Yeah, so we talked about kind of the expected symptoms, but risks that we hope you don't have, but are possibilities. One is something called ovarian hyperstimulation syndrome, OHSS. If you're somebody who has a high, naturally occurring high antral follicle count, so you're somebody who has the potential to grow a lot of eggs, then when you go through this process, when you're growing a lot of eggs, you can get quite symptomatic. You can get, in addition to the bloating, maybe you start to get nauseous, start to get short of breath, all of these things. If we realize that you're somebody who's at risk of that, because at that initial ultrasound, I see that you have a really high follicle count, I see that you're at risk for this, you're going to be somebody that will modify your protocol so that we'll give you kind of a gentler medication protocol to try to mitigate the risks of OHSS. Happens like 2 to 3% of the time. We've gotten pretty good at trying to cut down these symptoms. And so that's just something we'll be on the lookout for. Other risks are something called ovarian torsion. Your ovary normally grows one egg every month, and now we're saying grow a bunch. And so that ovary gets really big and heavy. It can
Mhm.
twist on itself kind of like a Christmas ornament and
Oh,
cut off
wow.
its
Okay.
own blood supply.
Oh,
It's
fun.
Yeah, no, that's bad. It's bad surgical emergency. We don't want that to happen. Happens
No,
less
no.
than 1% of the time. It doesn't happen frequently, thank God. But to prevent this from happening, an important guidance is going to be that we'll tell you no sex and no exercise for the week before your retrieval and the week after your retrieval,
Mhm.
because that's when
Mhm.
your ovaries are the biggest. So you can, walk your dog and get groceries and do normal daily activities, but
Just, like,
no
not going to
Peloton, no
Pilates.
running. Exactly.
Yeah. Also, I remember my friend going through it, she said she couldn't drink or have coffee. Was that or something? I remember. Is that something
Yeah,
that's part of
that
it?
answer that answer might vary depending on who you talk to.
Yeah.
I'm kind
Okay.
of the camp. I don't really. We're freezing eggs. We're not making, you're not getting pregnant or anything like that. So I don't really know that there like is any data to say that stopping drinking is
Mhm.
going to improve egg quality. So it's not something I necessarily recommend.
It's for, like, when you're going through the process, it's fine if you drink.
In moderation.
Yeah. Yeah, yeah, obviously. So, I don't know if we really got into this question, but, like, how many egg retrievals do you think? Like, I know it depends on the number of, like, where, just what you're generally producing and what you can feasibly get, but, like, what's a good number to reach for, a realistic number?
Yeah. So I think we started talking about this, but yeah. So An egg is a single cell and it has a lot of potential, but we don't know that for years to come, right? Like as you said earlier, egg freezing is a long game, right? We're freezing eggs now to potentially make embryos and get pregnant later, but we won't know whether it works until we come back to use them. So it's a long game. And so when you go to use these eggs, not all of them will survive the thaw, right? You think
Mhm.
85 to 90% will survive the thaw. Not all of them will fertilize. Not all of them will grow into embryos. Not all the embryos you biopsy will be genetically normal. There's a lot of attrition at every step. And so you need many more eggs to get to an embryo, to get to a baby. It's not just one to one to one.
It's like dating.
How? Yeah, there you go. Exactly. Got to kiss a lot of frogs. So we got to
Yeah,
go through a
yeah.
lot of eggs to get there. How many eggs you need is going to depend on age, as you said.
Mhm.
And so what I was mentioning before is we have something on our website called an egg calculator on our website,
Right, right.
and it'll give you an idea of based on how many eggs you have frozen, what percentage probability of a live birth you get out of that. That percentage probability, what probability you're comfortable with, is going to depend from person to person. Some people are like, oh, great, 40% probability. I just wanted to know that I had something in the bank. Other people are going to say 80% or bust. Like, that's the goal I'm
Mhm.
looking for.
Like, this is it.
How
This is what I'm
many
banking on working, right.
Exactly. How many eggs you need to get to the percentage probability you're looking for is going to depend on you and your age. So I urge you to play around with that calculator and say, okay, if I have 10 eggs frozen at 35, what percentage probability does that give me? What is 15 eggs? And that's how people can kind of decide what maybe their goal is.
So what happens if you, like, let's just say I freeze my eggs at 28 and then
Yeah.
get married in my early 30s and we're trying to have kids and it just happens. What happens to all the eggs that I froze? Like,
They're safely frozen for you, and they stay
I
frozen
guess,
until you call us and tell us, hey, I'm done with, my family is complete. I don't need them. And
right.
you can discard them or whatever.
Yeah,
But
makes
we'll
sense. I
keep them
mean,
for you.
do you think that like a lot of people don't come back for them? Like, what's the percentage of, I don't know if it's okay if you don't know this off the top of your head, but like, what do you think is just a rough percentage of people who actually go back to use them versus just like, it's just there, just in case?
I don't know where the number is currently, but I do know like handful of years ago when I was reading about it that the majority of people actually may not come back for their eggs, but I don't actually know the number.
Right. 'Cause it kinda sounds like it's like, because things happen, like, you could still have a baby, you could still, like, have a natural pregnancy or whatever it is, or
You
a
know,
different way, I guess.
yeah. So that's you asked me like, what age is a good age to freeze your eggs? Should we all do it in our 20s? They looked at this and they did a study where they looked at if you froze your eggs and at what age were you most likely to then come back, use those eggs, and successfully get pregnant. And the cutoff point they saw was 34. If you froze your
Mhm.
eggs by age 34, you were the most likely to, one, come back for those eggs and successfully get pregnant. When you freeze your eggs very early, if you freeze your eggs at 22, your whole life is ahead of you. Who knows like what your life will lead? Maybe you'll be partnered early, get pregnant early and never need these eggs. And that's a lot of years of storage fee and that's a lot of upfront cost to bear when
That's
maybe
so
you never
true,
need
right.
them. Whereas when you're a little bit later in life, maybe it's, if say you're 38 and you're not ready to have kids yet, and you freeze your eggs then, and you then come back a couple years later and you use them, there's a much higher chance you're going to use those eggs if you freeze them later, but the egg quality is a tiny bit worse. And so are you
Mhm.
likely to get a live birth out of those eggs? Maybe, but it's going to be different. And so 34 turned to be that kind of threshold that early enough that you get good quality eggs, but late enough in your life that you actually need those
Well,
eggs.
actually, that is such an interesting point. I mean, I'm 32. I don't personally don't think I'm gonna do this because I know we're probably gonna try to have kids soon if we want them. We also don't even know if we want them. But I can totally see how it's like, okay, if I'm like 36, and it's like, well, we still haven't made a decision yet. Maybe this would be a good option, to buy us some
That's
more
right.
time.
That's
Yeah,
right. That's a lot
yeah.
of the people's logic. Yeah.
Right. It makes a lot of sense. So another question that came up from someone is like, is it a realistic alternative to egg freezing to just like have your fertility checked every year or something? Like, is that an option if you don't want to do egg freezing, but you just like want to keep an, like, I don't know, to just know what's going on with your eggs and ovaries?
Yeah, so I think a lot of patients do come in just to get checked for their fertility. Like a lot of people just, we don't learn a lot about our reproductive health in health class or what in biology, et cetera. And so people just don't have a good idea of what's going on. So we get a lot of patients who come in who just kind of want to get a checkup. And there's nothing wrong with that. I think between the ultrasound and the AMH, we can kind of one, we can get an idea of what your ovarian reserve is like. But then two, we can also, when we take a full history and do an exam, we can see, are there any risk factors for having trouble getting pregnant in the future? Are you somebody who has like large fibroids that could get in the way, or have risk factors for scarring of your fallopian tubes? And if you have scarred fallopian tubes, then you may have trouble getting pregnant. Are there these other things that are contributing? A
Mhm.
check-in with an infertility specialist can kind of pinpoint those things just to say, hey, you might be at risk for certain things, or maybe you're not at risk for anything, and can kind of give you some reassurance. Absolutely.
Got it. I mean, yeah, this information has been amazing. I have a little game for you before we wrap up. It's fact or myth,
Okay.
egg freezing edition. I have a couple things I pulled off the internet just that are just
Okay.
at random.
Okay, let's do it.
um, okay, fact or myth, frozen eggs are just as good as fresh eggs.
Yeah, fact. So if frozen eggs before the age of like 38, if they survive the thaw, have the same reproductive outcomes as a fresh egg. So
Awesome.
there is a 85 to 90% survival rate. If you account for that 10 to 15% loss, once you get past that, then your outcomes in someone under 38 are equal.
Okay, noted. Fact or myth, egg freezing negatively affects your future fertility.
False myth, huge myth. Yeah. So, the way I think about it is that we are rescuing eggs that would have died off anyway, right? Every month, a group of eggs comes
Mm,
up, one ovulates, the rest die off. When I'm giving you hormone medication to grow eggs, I'm growing those eggs that would have died off anyway. We are rescuing eggs. We're altruistic. We're philanthropic.
oh, I love it.
Yeah, exactly, exactly. They're not exactly. So those eggs wouldn't be there next month anyway. So you're not borrowing anything from your future fertility. Your future fertility is unaffected by what we do today because you wouldn't have these eggs then
Love it.
anyway.
Right, right. Fact or myth, the egg freezing process causes early menopause.
Again, same thing, myth, so same idea.
Mhm,
We're not materially changing anything in the future. All we're doing is saving
mhm.
the eggs that would have died off. Next month, even if you freeze your eggs today, next month another batch of eggs is going to come up and that's unaffected. So, myth.
Got it. Fact or myth, egg freezing is only necessary if you're in your 30s single and want kids.
No, myth. I mean, people freeze eggs for any number of reasons, like even as you mentioned, right? Like some people don't know whether they want to have children. And so it may not be that you want to have kids. Maybe it's just that you want to keep your options open. Maybe you know that you're going to be doing some 8-year training program in Antarctica and you want to keep your options open and you're 28. You don't have to be in your 30s. You don't want to necessarily have kids. You don't have to be like a cis hetero couple. You can be any sort of permutation of person
Right.
and decide to proceed.
Love it. Well, thank you for playing. Thanks for myth busting and fact
Yeah.
checking. This was fun.
Anytime.
If there's one last thing you wish people knew about this process before going in, what would it be?
I think that where you freeze your eggs really matters. We haven't been freezing eggs for so long. Like I said, it's only been 12 years or so. And so freezing eggs is a hard thing to do in our labs. And so you want to make sure that you vet the clinic that you're choosing to get your eggs frozen at. Make sure it's a clinic that's transparent about their outcomes, that is going to tell you kind of what their egg survival rate is, what the reproductive outcome of those frozen eggs is. Make sure it's a good personality vibe, comfort fit. Make sure you vibe with your doctor because it's a long game, right? So you want to make sure that you trust who you're doing this process with because you won't know the potential of those. You are not going to realize the potential of those eggs for years to come. So you need to trust the
Mm,
place that you're doing and trust that they're going to deliver a good outcome and be also candid with you about those things. And so best thing I can say is just, do some research on what clinic you want to proceed at.
yeah, always. And what is a good place for us to get more info on this process?
Yeah, so I think going to our website, springfertility.com, is great. It's also where you can book a consult. I'm in the East Bay of San Francisco, so I'm in Oakland and Danville, but we have clinics all throughout the Bay Area and then also New York and Portland.
Amazing. Well, Dr. Reddy, thank you so much for this. All this information. I feel like my mind's blown. I knew nothing about this going into this conversation. So thank you so much.
Awesome. Thank you for having me. This was so much fun.